Well, up first on the show today, let's take a look at India numbers. In India, added 75,809 coronavirus infections and 1,133 virus-related deaths in the last 24 hours. Though the daily cases have seen a decline, India was reporting over 90,000 cases for 2 consecutive days. And after 6 days, we have seen a decline in the number of cases. The country's COVID death number, however, is the highest today so far. India is the second most affected nation, which has reached 42,80,442 COVID cases. And as we said, cases have dipped in 6 days now. And let's take a look at the top states which have reported the highest number of cases and deaths. In Maharashtra topping that list, followed by Andhra Pradesh, Tamil Nadu, Karnataka and UP. And if we talk about the deaths, again, it's Maharashtra, Karnataka, Tamil Nadu, Andhra Pradesh and Punjab. Well, let's now take a look at this worrying trend that we're seeing in some of the states of a second spike that's coming. This is after cases have declined and the curve has gone down. But then once again, there is a spike. The national capital has seen a jump in cases after seeming to decline in the last 24 hours. Let's just bring up that graphic that shows that second spike in Delhi. In fact, it had seemed that Delhi cases had steadied. However, a spike has been seen in the last couple of days, with cases being reported over 2,000. As we said, in the last 24 hours, 2,077 cases have been reported. And let's bring up the graph for Gujarat as well. And Gujarat has 1,05,509 cases of coronavirus. And there you can see the spike in cases there as well. So Gujarat also seeing a spike. In Assam, Assam has 1,28,244 cases. And there again, you can see how that graph goes. It goes up, then it declines, but then there is a spike again. So it's a second spike being seen there. And in Jammu and Kashmir as well, Jammu and Kashmir have a total of 44,570 cases. And there you can see the ups and downs, and it had come down slightly. But once again, the cases are going up. 1,013 cases reported in the last 24 hours. So a second spike being seen in states. Let's go across to Dr. Seth. Doctor, you were telling us your views on the situation where we're seeing a spike in some of the states.
Correct. Can you hear me very well now?
Yes, it's fine now. Thank you.
Okay, great. I said as a whole, India is a very large and congested country, more people per square mile than anybody else. And we're seeing the hinterland increase. So as far as India is concerned, it's still up and not a second spike. But yes, certain areas are seeing a second spike. And that's right. Not surprising. You see, there are multiple reasons for that. As we unlock, which is very important, economic activity has to pick up. More and more people are on the roads interacting with each other. Second aspect is there's a fatigue of the unlock syndrome, which shouldn't set in, but it is setting in. People are willing to go out and actually mix with each other. Transportation is opening up, interstate travel is opening up. People from outside are coming to major cities for treatment and into the metro cities for treatment. So we're seeing a multiple effect. Not surprising, but how do we control it is a real issue. We have to. Now, government has actually done a lot, has every day, day after day, for the past few months, had strategies around in an unknown area, which nobody in the world knew how to actually combat. We have seen the spikes happening in Spain. We're seeing the spikes happening now in America, and we've seen the spikes in UK. So it is a natural phenomenon. We have to start taking care. It is now up to us to prevent the spread of the disease in a second spike, because the responsibility now lies with the public. We know that we've got to open up. We know that we've got to travel. We know that we've got to travel by metros. We know that we've got to be in the buses, and we've got to actually sell our stuff or interact with people. But masking. Most important, if I wear a mask, I'm not just preventing disease process in myself, I'm actually preventing it for others. I'm preventing it for my family. Remember, this is a spread from an individual to an individual. This virus chases human beings and actually infects. If we wear a mask, it's a responsibility of ours to wear it, not just wearing a mask, which I see that if 70% or 80% have got masks on, majority of them have it only on their face or around their neck, never on their noses. In fact, they take off their mask when speaking. Now, I have my mask down only because I'm alone in this room. But the moment I step out, it is right up here. And that goes for every person you meet. That is important. Not only your immediate family members who live in your house. And even then, the elderlies who live in the house, I actually meet my 95-year-old father with my mask on. I think we've got to understand that now the ball is equally in our court as much as it used to be in the government's court in the past. And the spread from here has to be stopped by us. No one else will stop it for us.
Right, absolutely. I think we can't emphasize that enough, that it's our responsibility now. It's the choice between lives and livelihood, and the government has to make way for the economy to function, but at the same time we have to take responsibility for our health. Thank you so much, Dr. Seth, for joining us on the show and speaking so clearly on this entire issue.